Indonesia is facing its biggest surge of coronavirus infections so far. The Delta variant has rapidly pushed up case numbers in Indonesia, leaving hospitals in a critical state and facing a shortage of oxygen to treat patients. The government now says it's preparing for a worst-case scenario.
Camped outside an overcrowded hospital, COVID-19 patients fighting for their lives. The highly contagious Delta variant has swept through Indonesia, overwhelming the health system and leaving families in a desperate hunt for oxygen for stricken relatives. I used to refill at a kiosk near home, but there's no supply there, so I came here. The government is struggling to fill the gap. The demand for oxygen has increased 3- to 4-fold, and that's hampered distribution. There is indeed a shortage, and we have asked the 5 biggest oxygen suppliers to dedicate 100% of their production to medical needs. To stop the spread of the coronavirus, the government has imposed a partial lockdown. It also wants to step up vaccination efforts, but with doses in short supply and only around 5% of the population fully vaccinated, another shortage is making itself felt. To cope with the rising death toll, farmland across the country is hastily being converted into makeshift graveyards.
Well, the charity group Save the Children says it's deeply worried about the impact of the pandemic on children in Indonesia. I'm joined now by Dino Satria from Save the Children in Indonesia. Mr. Satria, thanks for your time. Children have been globally generally less affected by COVID-19 than adults, but the number of Indonesian children contracting the coronavirus has tripled since May, and more are dying. Why is that?
Yes, good morning to you too. Well, we really don't know why this is happening, but of course the statistics says that around 12.5% cases of COVID is children. This is what gives us very concerning, and the reason is one of the reasons perhaps. And one of the things that we are trying to advocate government is to distribution of vaccine, especially to children, which the government already done that past couple of days. But Indonesia is very large areas, and basic services is already difficult, depending where you live, basically. And where we work in remote areas, basic services such as health facilities is also difficult. And especially also to get the vaccines is also very difficult as well. So this vaccine is not widely distributed widely enough, and I think this is one of the causes of the spread, especially to children as well.
How will Indonesia cope, and countries like it, with vaccines remaining in such short supply, and as you say, those access issues? How will they manage to combat the coronavirus?
Yes, I think, of course, the government is doing whatever they can right now. But I think Indonesia also needs to reach out to different government or other countries to support this vaccine, and also trying to speed up this process. Looking at internal resources as well, such as industries, corporates that can help to, deliver this vaccine more spreadly all over Indonesia, basically. I mean, Indonesia also has a lot of resources as well, basically. It's just how to manage that and to distribute it widely enough.
Indeed. What other measures are the Indonesian government taking to try and combat this surge?
Yes, now the government already have stricter restriction since 2 or 3 days ago, but personally, I hope that was happening like 2 or 3 weeks ago. But of course, that's only focusing only in Java Island. But we are also addressing the government that to have more widely social restriction across Indonesia as well. Of course, this will be a lot of challenges, definitely, especially for the economic side, for underprivileged community as well.
Indeed. All right, Dino, thank you very much. Dino Satria from Save the Children in Indonesia. Let's take a look now at some other developments in the pandemic. Data from Israel shows the BioNTech Pfizer vaccine is less effective at preventing mild coronavirus infections. Scientists believe this is because of the highly transmissible Delta variant, but they say the vaccine is still highly effective in stopping serious illness or hospitalisations. Germany has announced it will ease quarantine rules for travellers from the UK, Portugal, Russia, India and Nepal. Those who are fully vaccinated will no longer need to isolate after they enter the country. And Luxembourg's Prime Minister is in a serious but stable condition in hospital after contracting COVID-19. Xavier Bettel was partially vaccinated against the virus after one AstraZeneca jab.